Yeah, we saw some very interesting data at ASCO this year for myeloma, especially in terms of what the horizon is going to be looking like in terms for new therapies. There were three or more abstracts that were presenting on the results of CAR T in myeloma. We saw results from the KARMA trial, which used the BB2121, again showing high rates of efficacy, a median duration of response of about 10.7 months. Um, and it clearly shows that we can get really deep responses, including MRD negativity. We also saw some results from the Janssen CAR-T, from the CAR-T2 trial that again demonstrated high rates of response. Almost 100% of the patients responded to treatment despite having been heavily pretreated. We don't really have a lot of long-term data yet. Similarly, we saw yet another CAR-T with a slightly different construct that also seems to be quite effective in terms of responses, but it was even earlier than the other two in terms of the follow-up at this point. So that is clearly an attractive treatment approach for myeloma. And as we have results from other trials, we'll get a better sense of where we're going to be placing this particular class of drugs or therapeutic agent. We also saw some data with belantamab, both in combinations as well as in patients with renal insufficiency. The data looks quite interesting. The drug clearly is active in patients who have been heavily pretreated. However, we did see some toxicity, particularly ocular toxicity, in a significant number of patients, which clearly needs to be managed for this drug to be used widely. We saw some data with selinexor, both obviously the phase 3 trial that compared selinexor with bortezomib dexamethasone versus bortezomib dexamethasone, the Boston trial that showed that there was approximately a 4-month improvement in progression-free survival when selinexor was added to bortezomib and dexamethasone in relapsed refractory multiple myeloma. We also saw data with selinexor combined both with carfilzomib and daratumumab, and both these combinations appear to be quite effective with high response rate, especially in patients who have not seen these drugs in the past. So that is another agent that clearly is already in the market, but certainly looking at these combinations will give us a better sense as to where it would have the maximum impact.